everybody, and as promised, here's another video on your homeopathic treatment and how I expect you to deal with other medication, because obviously I'm not going to tell you to stop really important medication that you've been prescribed by your doctor. So the kind of medication I am talking about is your thyroid medication. You need to continue that. Your insulin, your asthma inhaler for the moment, anything that you've been prescribed, you need to stick with. And there may be a time in your treatment that you can taper it off, but it always needs to happen together with your doctor. Yeah, so this is super important to mention. Now, the rest of this video, I want to talk to you about the medication that is generally over the counter, or that you only take as and when. So this might be your ibuprofen, this might be your antihistamines, this might be antifungal cream. Yeah, so those kind of things. The thing is, if you look at the difference between those medications and homeopathy, this is the big difference. Homeopathic remedies trigger your own healing mechanism, right? Your body tries to heal in many different ways, but one of them is by getting rid of infections and inflammations and toxins through all the eliminating processes that we have. So that could be through perspiration, it could be through the bowels, it can be through the skin, it can be through urination, and with women it can also be through the cervical mucus and the menstruation. So what do a lot of, and a big one, you might be getting a big fat cold to get rid of something, or a temporary fever to burn out the inflammation. Now, if you have a fever that is a decent fever, so not the kind that is going to get you into hospital, but a normal type fever, if you're going to take something to suppress the fever, then your body is not able to get rid of the problem. You're just going to stuff it back down. Then I'm going to give you a homeopathic remedy. The body is going to try and do the fever again, and you give the medication again. And you kind of get a catch-22. The same counts for maybe you have a bladder infection or a slumbering one, and we have found out through your case that it actually started with a thrush problem, so a candida issue. Now, I give you a remedy, your body says, oh, we don't need to do the bladder stuff anymore, but we're going to move it down a little bit and go back to the thrush situation. And you think, ooh, that's itchy, that's not good, don't like this discharge. Let me get some antifungal cream. And you kind of shove it back in and your bladder issues come back. So those are important things to consider. You can't always get around them, right? You can't. If your body ends up in a healing crisis, which sometimes might be the case, then you need to use some medication to get through that situation. We don't want to end up in what they used to do in the olden days, like, well, the treatment was excellent, but the patient died. No, we are not going to end up there. So if you have any concerns or any doubts, by all means talk to me about it. But don't think because I'm treating you for fertility or for hot flushes that I don't care about your antihistamines. I really do care about those because, again, antihistamines, they suppress. And if we are treating you for a condition and suddenly you are getting a big fat cold, but you interpret it for allergies, there we go with the same issue of suppressing while the homeopathic remedies stimulate your body to heal itself. So this video is mainly to make you aware of this process. I am sure that it will raise a lot of questions and it might not even apply to your case, but I thought it was relevant to do this little sermon on a video for you so that you can be made aware of that this might be going on in your case, and that it's something that I might want to know about if you haven't shared it with me yet. By all means, I can help you out. This counts also for fevers. I've treated so many babies with high fevers that are really, really scary to parents, and I never want you to feel like you're alone in that situation and that I'm expecting you to let your baby run a really high fever. That is risky. I don't like risk at all. In certain cases of infections, I might also ask you to get the antibiotic course and that we agree to a deadline. We want the infection to be improving within a certain amount of hours and have the antibiotics as a backup. So again, I'm not about risk at all, but I do want you to have an opportunity to give homeopathic remedies a chance without suppressing the problem again. And yeah, I see that I've already have been talking for 5.5 minutes. I think I've made my point. So I'm going to upload this video, and by all means ask me if you have any more questions, and I might need to do another video. Have a lovely day. Bye.